Sadly, we have to report one more person passed away from COVID-19 last night, a woman in her 70s. That brings us up to 227 people that have passed away from this, and to all the families that have to go through this. It's a tough time, and our condolences and prayers go out to you. As of today, there's 12,078 cases of COVID-19 in Albany County. We have a net increase today of 300 positive cases since yesterday. This is the second consecutive day we had at least 300 new cases in a single day. Yesterday was alarming at 346. Dr. Whalen and I have said this time and time again. We knew we were going to be in the 300s, and keep hoping that we were wrong. It now brings our 5-day average to 271 positive cases a day. Yesterday was 258.2. There are currently 2,968 people under mandatory quarantine. Yesterday, that number was 3,165. Of the new positive cases, we know 38 had close contact to a positive case, 17 are healthcare workers, 245 don't have a clear source of infection at this time. As of today, there's 38,625 people now have completed quarantine. Of those, 10,320 were positive with COVID-19 and have recovered. That's an increase of 266 recoveries since yesterday. I've been saying January will likely be the most challenging and hardest month that we faced in these last 9 months. And we need to brace and do the right thing, and we need to wear a mask and cough into your arm and clean your hands and stay 6 feet apart. Considering December's numbers, record numbers that we beat, we were beating numbers in November with records, and then it went through December. And unfortunately, that trend's going to go through January, and I'm hoping it will hit the apex or plateau around the 15th of January, but I'll be honest, it's just what I'm hoping. The numbers keep going. What people did for Christmas and New Year's and for the holiday is going to define us for the next 2 to 3 weeks. Unfortunately, since January 2nd, we're off to a disappointing start. There were 30 new hospitalizations last night. We've been averaging around 15 new hospitalizations each day, so the increase today is a bit alarming. What's worse, there are now 133 people currently in the hospital from the virus. We've never had that many COVID-19 patients in the hospital at one time before. Our previous record was 129, was the highest, which was on December 30th. Albany County hospitalization rate has been trending down the last 2 days, and I was happy to see the hospitalization numbers were dropping yesterday, and last night it got alarming when we started to look at the numbers and getting them in. We're back now around 7.52% for people going into the hospital, and 22 patients are currently in the ICU. We had 21 yesterday, so an increase of 1. I'm going to say it again. I urge people to wear your mask, cough into your arms, clean your hands, and stay 6 feet apart, and we'll get through this. We need everyone to do their part. I've said this, it's going to take about 6 months until the vaccine is widely out there. If you read the New York Times article yesterday, the federal government was hoping to put out 30 million people, get 30 million people have the vaccine by December 30th. I believe they only did 2.8 million by now, and that's alarming. And if you think out the vaccine that went out, over 12 million vaccines went out, did not get to people. I know we had Operation Warp Speed. It probably turned into Operation Flop. I know the general talked about it, and he took ownership for this. But we have to do better. We're one of the best nations in the world. We should have figured this logistics out and got it out and get it out to the people. And we need your people's help to make sure that we get it out. Only 167,000 people in nursing homes got vaccinated so far. We need to do better, because that's the population that COVID-19 is affecting the most at this point in time. So it's one of the reasons why we put up Albany Med's website yesterday to remind people to go on there. You can look at the category you're in if you're 1A, 1B. And please, they are taking EMS people first, and essential workers and hospital workers and stuff like that. Wait your turn. I know I know people want to get out there. I know they want to get the shot. They show up. You just bottleneck it when you show up when it's not your turn. One of the things we kept getting back yesterday via email and Facebook was, how do you know? When I said people over the age of 65, and Dr. Whalen will be able to explain this better than me, who with underlying health issues, how do they know to identify when they're up for the shot? You got to work with your doctor. You got to help us. This is new. You got to go to Albany Med's website, register. You can see the group. Your doctors have to educate yourself. You have to educate yourself, people. You got to help us help you to get through this. And we can get through this if you're working with us. No, we're not going to be able to define 320,000 residents in Albany County, upwards of 1 million people in the 8 counties that make up the Capital District. So we need your help. We need your help to identify people. We need your help to make sure no one's forgotten. So to make it work, we need 70% of the vaccine rate needs to stop the spread of this virus. Think about it, 70%. If you look at the statistics behind the vaccine and how far modern science has come in the last 10 to 20 years, you would feel better about getting the shot. We need to encourage people to continue to educate themselves, continue to go out there and get the vaccine when it is your turn, and we'll get through this. Less than 1% of the people have had a serious reaction so far to the vaccine. Look at, I guess you got to choose your words, right? But I will say this, the vaccine's not killing people. COVID-19 is killing people. So please, get the vaccine when it's ready for you. Dr. Whalen.
Good morning and Happy New Year. Cam, can I ask you to put the second slide up with the epi curve? So I want to talk about two things this morning. First is the amount of disease that we're currently seeing in the community, and second is the vaccine. So if you look at this curve that we look at every time we have a press conference, and that is available on our website, you'll see the difference between the first surge and the second surge of COVID-19. There's a tremendous difference. What did we do the first time to flatten the curve? We had massive shutdowns. And those massive shutdowns were part of the reason why we decreased the amount of disease in the community. Currently, we are experiencing a 4-fold increase since that first surge. And as we discussed around Thanksgiving, as we discussed around Christmas, we are now seeing what we hoped to be proven wrong about, which is the surge upon the surge. So our numbers are now in the 300s for the past 3 days. This is a big concern, and certainly 30 new hospitalizations yesterday is a very serious concern. So what can we do? What should we do? And the answer is stay home. Stay at home if it is at all possible for you to do this. Work from home. Keep your children at home. Avoid socialization in groups outside your immediate family. This is essential. We have to now put ourselves on individual responsibility for shutdown. And to the extent possible, that is the way we can currently flatten the curve before we have widespread availability of the vaccine. So while it is essential to wear your masks, to wash your hands, to stay socially distant, and to avoid large gatherings, I urge people to consider an additional step of asking every time you go out the door, do you need to go out the door? It is really important that we not overwhelm our hospitals and their capacities. So give it some thought. I know there were a great number of people that followed advice over the holidays just to stay within their immediate family realm, and there were many people that didn't. There were parties that occurred on New Year's Eve. We know this. What are the likely implications of that? We'll see in the coming days and weeks. But we all have to realize that the behaviors that we are choosing on a daily basis can influence what happens in the coming days and weeks. And if you protect yourself, protect your loved ones, protect strangers, make awareness of COVID-19 and what you can do to protect yourself your New Year's resolution, so that we can see decreased rates, so that we can again ourselves start to flatten this curve. So I want to talk about vaccination as well. And as Dan just indicated, we have linked our webpage with the webpage of the hub, which is Albany Medical Center. And we continue to work very closely with AMC as our regional hub and the other local health departments and the other hospital systems in our area, in our region, to coordinate response of vaccine deployment. And I think this is a tremendous effort, and it's going very well. We are getting, our partners are getting vaccine out to the 1A community, and we are geared up this week to receive our first shipment of vaccine at the local health department, and look forward to working with them and coordinating vaccine response going forward. It is a tremendous lift for us as we have this exponential increase in cases, which our staff are still working to contact and do case investigation and the contact tracing, and now to mobilize large-scale vaccination efforts will be a big challenge. A lot of you have heard in the media about the need for volunteers, and I want to clarify, because I got a message from a friend of mine who's a clinician and said, is this duplicating your efforts? So that's an important point to clarify. It is not duplicating our efforts, it is our efforts as well. So the information that the regional hub is putting out about needing volunteers is our information as well. Those volunteers will serve with us as well. So there's one site, Serve New York, that is listed, that providers, there's a list of who can sign up. So it's physicians, it is nurses, it is PAs, nurse practitioners, others with some clinical expertise, and you can assist us in getting this vaccine out. And in the coming days and weeks, it's going to be a big challenge. We want to ensure that the rate limiting step in our area is the amount of vaccine we're getting, not the ability to get it out. So that vaccine volunteerism is going to be a key piece. And you know, we've worked with our Medical Reserve Corps on many efforts, and COVID is certainly one of the most prominent to assist us with the work that we do. They're an incredibly valuable group. They're more valuable now than they've ever been before. So please know, when you see those sites go up, those are our sites as well. Those are local health department volunteers as well. Secondly, we're getting a lot of questions on the prioritization and how can people get information on the prioritization and what is the plan over time. So everything that we know is public knowledge, and it is on the AMC's hub site, which is linked to our local health department site. Currently, as the county executive just indicated, we are focusing on our 1A workers, and we are seeing a plan evolve over a period of weeks. And each week, there seems to be an addition to the 1A population. We are now in week 4 of vaccination. And I'm happy to say that during this week, the local health department staff that will be working on pods becomes part of the eligible population to receive vaccine. So we will be vaccinating, when we receive our shipment, the staff that will be working on the pods and working towards facing the public. We will also be hoping to vaccinate our volunteers that can assist us with this. This is going to be an important effort, and we want to make sure that we can continue it. We will also be working to assist with volunteering with with home care staff and others that are in the 1A. So we're doing this in coordination with the regional hub. And the regional hub, as I've said before, is having daily calls every single day, except Christmas and New Year's. And as I walked in this morning, a lot of you will have noticed I was on a call, and that's what it was. So this is a daily communication and coordination that's going on. I have heard across the state that the model that we've developed, or that has been developed by our regional hub, is one that others are looking to for the strength in its coordination, and I agree 100% with that. I think it's a great job, and I give kudos to Dr. McKenna and Albany Medical Center for leading this up, and look forward to continuing to work with him, his staff, the other local health departments, and the other regional hospitals to get vaccine out in the coming days and weeks. We need to get the vaccine out as quickly as possible, but we also know that it's not going to be widely available for a long period of time. So the measures that need to be employed for control are more essential than ever. Thanks.
A lot of the superintendents in Albany County are looking whether or not we should pause. Some of the schools go back January 4th. And, look at where I put it up through the control room. I'll let Dr. Whalen talk about this if she wants to jump in, is that I do recommend that schools pause. Alarmingly, we're seeing more and more kids. We're going through the data that have COVID-19. Well, that infects the teachers, that gets to the administrators, that gets to the people in the school building. A lot of schools are remote already. It's one of them conversations I got to have with the presidents of the major universities here in Albany County to maybe not come back until the end of February to the vaccine. The kids get vaccinated, and maybe their semester runs into June of this year. We need everyone to pause. We need everyone to do what they can do. I do not have the authority to shut schools down. That lies with the governor's office. So our recommendation is to try to get that guidance so we can pause the school districts. They were online learning. They're doing things differently. All schools are capable now of teaching remote. I would recommend that's what they do. But again, I do not have the authority to do that. I don't know if Dr. Whalen, you want to say anything on that, or?
So I'm glad you brought that up, and it was a reach out from our school district superintendents to discuss this, and I think it's a really important discussion. I do think we are seeing cases within the school systems, and I think that we have concerned parents, students, and teachers. I don't think it's an easy decision. But I think right now, given the rates of positivity that we're seeing in the capital region, it is certainly a decision that we should consider carefully. While we may not have the ability to close schools, the superintendents certainly do, and they can weigh up their considerations. We know that all of the information available to them on students that have tested positives in their individual schools, that's all available, and they are looking at that information and weighing up. They also don't, understandably, want to start back with in-person learning and then have to change course. And they are concerned, given the trends that we're experiencing, that may be a concern, and they want to have consistency. So I certainly understand their concerns and considerations, and look forward to a discussion with them on this.
Thank you. And listen, people should be thankful for what you have. In Times Union, I think it was Claire, I hope I got that right, they did a nice article on our SNAP program. Over 51,000 people get SNAP. And Aldi's and Walmart and Sam's Club and I believe ShopRite, and there's probably a few other places I'm forgetting, do free online delivery to residents, which is great. And they're doing this through COVID-19, and they're not charging them for it, so people don't have to go to the grocery stores. They don't have to shop. They can get it delivered to their house for free. So please, people, read that. If you're on it, we're reaching out to the people that are on SNAP to make them aware of these free services that are available for them to keep them home. I say to everyone, please, like Dr. Whalen said, stay home if you can. don't go out if you don't have to. I know it's hard. I know it's difficult. I know people are done. They're tired. They're over this. The vaccine, like I said, it has to get out, and we have to do our job to educate people to get the vaccine. So we get to that 70%, but we also have to make it available. So please bear with us, and so we can all get through this together. So again, I want to remind you some of the tools we do have in the arsenal is the partnership with Whitney Young, and to them and to their organization. But please, you can call there if you have insurance. You don't have insurance, we pay for it. 518-465-4771. Albany, many sites across the state that you can go to, free, don't charge anything, no co-pays. I know some people have some co-pays. Please, I can't do anything about your co-payment. That's between you and your employer. But if you got a high copay, go to University of Albany. It's free. You don't have to worry about your copay. I know some are crazy. They're $60 or $80. We did get some people to say that they didn't want to pay I think it's $35 for the kits when you come out of the airport if you want to do that swab test. Things cost money, and if you don't want to do it, it's convenient, it's quick, it's a 48 turnaround, 100% accuracy rate. And trust me, after getting the swab up your nose multiple times, it's not fun. I don't like it, and it's not comfortable. So it is an alternative. So, but again, go through the University of Albany, or if you don't have insurance, go to Whitney Young. Our many partnerships with Price Chopper, CVS, Walgreens, and everyone else, Rite Aid. Thank you, Priority One. Can't get through this without you. To the University of Albany. To call is 188-364-3065. Go to our website at albanycounty.com. Again, the wait times, the age groups, if you need kids to get tested, and and again, you get mad at me. We try to be as accurate as we can with the time that you have to wait. But unfortunately, people do show up, and if they don't have a slot of time, they wait, and it gets crowded, it gets backed up. Please just try to make an appointment so you can leave them offices not as crowded and you don't have as many people in one area. As always, our mental health support's available 7 days a week. 518-269-6634. Our 24-hour sexual assault hotline number, 518-447-7716. The Karen Ziegler and her team, thank you for everything that you do. And our 211 with Pete Gann and United Way. Pete, thank you for what you're doing for the Capital District. And New York State hotline at 188-364-3065. I do want to say to the people watching this and listening, I'm going to give you a little challenge to you, and I think it was Bethany Bump, a little challenge. The people that passed away in the Capital District last year, and it broke down who they were, but it also broke down, I think you did it in the Altamont Prize too, their underlying health issues. If they had some, if they didn't. It's not a good read, because it's not a good feeling to go through that and watch people that tragically lost people. But to the people that think just because you have an underlying health issue means that you're going to die anyway, no, that's false. And Dr. Whalen can say that better than I can. I'm not a doctor. It's alarming. It's alarming to read, and it's sad. And there's a lot of people that passed away that didn't have underlying health issues. So again, please educate yourself. Be smart about it. Be safe out there, and we'll get through this. Thank you.